Hi, everyone.
Hi, everyone.
My name is Sarah Kelly Palmer.
And I'm Kayla David.
Welcome back. It's nice to see everyone again. As many of you know, Kayla and I are part of the healing department at Family Service of Rhode Island. Welcome to those who are new joining us this week. We come to you weekly here on Facebook as part of our Be Well RI information series. And we discuss various topics related to how to cope during this COVID-19 crisis. Family Service of Rhode Island is a large social service agency, and we have been serving Rhode Islanders for more than 125 years. And we offer a large variety of services, including telehealth counseling. And Kayla and I just really want to remind everyone that now more than ever, we really need to be focusing on our mental health and our well-being just as much as we're focusing on our physical health. And Family Service is here to help.
So we'll be joining together today and every Wednesday at 10 a.m. to have discussions about supporting wellness during COVID-19. So we would love it if you took a moment to share this with your friends or to start a watch party and help us to get this message out to as many people as we can during this COVID-19 crisis. Today, in honor of Mental Health Month, we are very excited to have a discussion about de-stigmatizing the act of reaching out for help. So now more than ever, it is important for us to be able to reach out if we're struggling or if we have a loved one that's struggling and be able to connect with assistance. So we know right now more than ever, COVID-19 has put a great deal of stress on us in many different ways, and it can be impacting our overall well-being as well as our mental health. So as Sarah had said earlier, we really want to be getting out that message about kind of what services are available and how people can engage in those services and that you're not alone.
And Kayla mentioned May is Mental Health Awareness Month. We know that millions of people across the country are impacted by mental health struggles each year. 1 in 5 people will experience a mental illness during their lifetime. And all of us experience challenges and life circumstances that can impact our mental health and our well-being. So today, we hope that our discussion will help to raise awareness and also dispel some myths about taking that step to reach out for professional help if you are impacted by mental illness or substance use disorder.
So we are very, very excited to have a special guest joining us from Family Service of Rhode Island today. Her name is Kim Quinn. She's a certified peer recovery specialist and works in our health department at FSRI. Welcome, Kim.
Hello, thank you for having me.
Hi, Kim.
Hello.
Kim, we are so grateful for you taking your time to talk to us today. And for those of you who are live with us and maybe for the first time or have been with us for a really long time, but maybe have never thought to use your comment box before, please don't forget that you can always ask questions in the chat box and we will try to answer them in this segment. So please don't hesitate. And I see people putting live comments in, so thank you. So Kim, we thought we would have you start by sharing a little bit about your role at FSRI as a peer recovery specialist. What are peer recovery specialists and what do they do?
So a peer recovery specialist is a person with lived experience. So me personally, I'm a person of long-term recovery. I have not found it necessary to drink or use drugs in over 10 years. I practice abstinence. And we try to empathize and understand, and we can actually really understand and put ourselves in the situation of the other person because we've been there, So we do share bullet points and bits and pieces of our story to help the other understand that we are there with them. We help them access. We meet them where they're at, first of all, and then we help them access what they need to help themselves move forward. So I start just by, getting to know them. Once I get to know them, we work on a goal plan, a wellness plan, whatever that looks like for them. And I always tell them they're driving the bus. I'm just helping them drive that bus. And I also let them know that it took a village to get me to where I am today, and that everybody needs that village.
That's awesome, Kim. I love that idea of that it takes a village, right, to help and support. We all need that village. So in your journey, how did you find yourself doing this work about kind of giving back and, as you're saying, meeting people where they're at and helping them to get on their own path of wellness? What brought you there?
So I felt like at about 6 years in my recovery, I had healed a lot of that, little girl that used to drinking drugs. So a friend of mine invited me to go into a training. And in that training, to become a peer recovery specialist, I found out my soul's purpose is at first to help mother and children. But then as I went on with this work, it's, I found out that anybody in recovery, from mental health, from substance, from anything, all has the same need. And that's just somebody genuine that's lived it, to be there by their side, to guide them through what they need to go through. So I found that my passion is to help people. And I was at a dead end job with, in the restaurant world. And, I was just making a paycheck. So now it's kind of like I don't even go to work, because it's so fulfilling, helping others, So I celebrated 10 years at the beginning of the month, and a friend of mine asked me, what's the most important thing you do? And I said, if I don't help others, I don't stay sane. So
Congrats, Kim. That's amazing.
Seriously, that's amazing.
Yeah.
And you were talking about, like, there is this point at the beginning that can feel really scary when you are maybe thinking about reaching out for help, or there are so many barriers, right, to reaching out for help. It's even really hard to reach out to loved ones or to people that we know, let alone a whole new person, a therapist or an agency. So I was hoping, Kim, because I know you do a lot of this work, that you could speak a little bit to the barriers that might commonly, present to people that might prevent them from reaching out when they're struggling with mental health struggles or substance misuse or addiction. What are some of those barriers that people, might encounter when they're thinking about taking that first step?
I think the biggest barrier, is that they feel like they're a burden to people. I'll use yesterday as an example. I reached out to a new client and new peer, and this person said, when can I call you? I said, you can call me whenever, and I'll call you back when I can if you get my voicemail. And she said, well, I don't want to bother you. There's a big thing that they're bothering us. There's a lot. I think we are our worst problems. We carry such guilt and stigma of ourselves that it's already so hard to reach out, because we have been there, and the person that's still struggling or still using or still, not finding the right medication, whatever it may be for them in their mental health, not finding the right doctor, the right provider. So we put a lot of strain on ourselves. So it's already hard to pick up the phone. And then when you pick up the phone, you don't know where to start, and if you have picked up that phone before, you get the same thing. You've got to go through, all these assessments and and over and over and over again, and keeps telling that story and telling that story and telling that story. So it's really hard. It's really challenging. But I like to tell people the best thing you can do is still get out there, tell that story, and pick up that phone, and that we're equal. Just because I'm a provider, or anybody's a provider, or you're a doctor, or you're a therapist, or you're a psychiatrist, whatever you are, whatever your role is, we all struggle. There's not a person in the world that doesn't struggle. You can have the best of life and you're still going to struggle. And you're still going to go through hardships. So everybody reaches out.
Yeah, Kim, and you just talked so eloquently about the stigma, right? And how that can be such a barrier, as you're saying, for people to reach out. And part of your job as a peer recovery specialist is really kind of normalizing this experience. And just as you said, right, we all struggle, right? We are all on an equal playing field. You know, substance use disorder, mental health struggles do not discriminate, right? We are all impacted in some way. So how do you, as you talked a little already about this, but how do you as a peer recovery specialist help to kind of normalize that, right? How do you help your clients see that?
So I do exactly what we were talking about before. I try to break those barriers,
Mm-hmm.
so if they are afraid to go to their doctors because they're, you know what I mean? They're in the process of
Mm-hmm.
another doctor change or another med change, or they're going back into an outpatient, or they're going back to
Mm-hmm.
detox, or I try to be that person that can either stay on the phone with them while they do that, or
Mm-hmm.
go with them to it. If there's somebody that's already in recovery, if they're a 12-step program, an recovery program, I try to hook them up to like access recovery community centers because they're wonderful.
Mm-hmm.
Um, hand holding. Like I needed
Yeah.
a lot of hand holding. I needed somebody to tell me how to tie my shoes,
Mm-hmm.
get up and eat breakfast. And, it's life changing. I literally had to change my whole life. So I know what that's like. So anything I can do to help them get to the next, from A to B, then I'm going to do it. If you need your driver's license, I'm going to go sit with you. You need to sign up for school. You want to sign up, anything. I'm going to go with
Mm-hmm.
you and I'm going to go through the process. If you need that, if that's your fear is going alone, then I'm
Right.
going to, I'm going to help you do that.
Yeah.
And resources, give them all the resources they need if they're asking for it.
Mm-hmm.
Most of the time they're just asking, they really want somebody to listen and to understand.
Well, I think, Kim, we met several years ago, and I love peer recovery work. And I think it's just a beautiful thing that's happening in Rhode Island, that we're finally seeing this acknowledgement for this
Mm-hmm.
unmet need, right? Of being able to share your experience with another person, which many providers, ethically cannot do. So that does make a divide, right? And I do think there's also that piece of, being able to have people that can go and really do that. I mean, that hand holding, or that, I mean, you said it so eloquently. I woke up one morning and my whole life was changing. And I needed that. I needed someone there
Mm-hmm.
just to listen, or just to be present, even if I wasn't speaking, to kind of bear witness to this change with me. And that instills this huge amount of hope. And I think, that's what I love so much about this work, is it does, you as someone who has been 10 years in recovery and have those experiences, you can share that, and that can give hope that there is this,
Mm-hmm.
there is this path, there is this way of moving forward in a healthy way. And there's a way to cope with things, anything that comes up, in a healthy way. And I think that that's just such a huge piece around kind of the stigma, right? Or de-stigmatizing, is saying, there is other ways we can cope with anything in a healthy way, but it does take a lot of support, and it takes reaching out, and it might be really scary to reach out to a loved one that you've reached out to like 4 times before, right? And that kind of that shame and guilt that comes with that experience. And I think that's one of the questions that I had, of like, Kim, if you were talking to a friend or a loved one, of someone who really needs help, and you spoke to this before, we have this kind of guilt or this stigma or this shame about reaching out maybe to our loved ones. What advice would you give those friends and family members on how best to support that person, or how they can reduce that shame, that guilt, that stigma of asking them for help if they know someone that they love is struggling?
So I always like to remind people that when you're reaching out and somebody else is reaching back, you're helping that person that's reaching back just as much as you're reaching out for help.
Mm-hmm.
So it's not this one-way street where, Kim's calling a friend because Kim needs help, because, you get into that conversation and then you find your friends, you know what I mean? For a minute, she was listening to you, but she's having a bad day, or he's having a bad day. So every time you reach out, and you just got to keep reminding them that as hard as it is to reach out, once you reach out, a problem shared is a problem cut in half.
I love that.
As soon as you talk about it, you're letting half of it go. And whether you're going to get a solution from a friend or not, hopefully you are. Hopefully you're reaching out to the right friends. And you know, when the hand reaches back, we're not above or below each other. Anybody, you know, no matter where you are or who you are. And you got to just keep reminding your loved ones. And if they really physically can't reach out, maybe call one of their friends and have their friend call them, you know. But it's definitely a two-way street. It's never one way. Never one way.
And Kim, I think that piece is huge around, like, if someone has reached out to you 4 times before, still be there if you can be there on the 5th time, right? And I think that there's this idea that people can't change, that you know, people who have issues with addiction or substance use or misuse, that they're not going to change, right? And that's not true. And I think if we can let family members and friends know that, right, of if you're there, this is such a helpful thing, and you're not just helping that person's helping you, that relationships are really 50-50. I love that idea of, you know, a hand reaching out is also a hand, like that there's an equitable relationship there when we're reaching out for help.
And relationships take a lot of work. So if you got to reach out 4, 5, 6 times, you're teaching that other person, and, you know, you're setting boundaries. They're learning from you. You know, when I could talk this stuff all day, but when I'm out in the community, if I'm not walking it, you know, there's people around me going, oh, really? I seen her, you know? So if I'm leading by example and I'm being honest with myself and I'm reaching out to the people and I'm building those relationships with people who knew me in my early recovery and people who are still in my life today, there was a lot of work involved in that. But those are the people that helped me and I helped them. And now, I mean, I've changed my array of friends, you know?
Yeah. Well, and it's that idea, Kim, about that it's a two-way street, right? So you talked a lot about too, reaching out for help. People often feel like they're a burden, right? But if you approach it from that idea of, I love that, a problem shared is a problem cut in half, you know, it takes that idea of that I'm a burden if I'm asking for help to, this is a two-way street and we can help each other. So I love that framework. That's really, really great.
And it's also that idea of, you know, and mental health, suicide awareness, all of these things are, if you see something and someone seems off or they don't seem like they're doing so well, that it's okay to reach out for help. It's okay to name a potential problem, right? I'm worried or concerned that you're thinking about suicide, whatever it is, that it's okay to do that. We don't necessarily have to wait for that person. If we're really concerned that someone is acting, you know, outside of their norm, or we're concerned that they haven't been able to go to work or they haven't left their house, right? Or we're really worried about them. Their kind of mood has changed. They're giving away things, whatever it is, that we can say something. It's okay to say something. And if someone isn't suicidal, by saying, are you thinking about suicide? It's not going to necessarily make them suicidal, right? But it does kind of lead to that kind of, we can reach out too. And I think that that's a really important message, that, you know, you don't have to wait for someone to reach out for help. You can say, you know, are you okay? I'm worried and concerned about you. And that's a huge part of the COVID messaging, right? Is reach out to your friends, reach out to your loved ones, and that it's okay to just ask, how are you doing? Are you okay? Or say that you're worried about someone.
Even your neighbor, you know, if you're gonna, you know, if you hear something going on that just isn't right, you know, knock on their door and ask them if they're okay. You know?
Yeah, it's so important.
It's so important. And I was that person that, you know, that couldn't reach out, and I had the right person in my early recovery that would always reach out to me because they knew it, you know? So when you reach out to people, I tell you, it's the world of difference. Like, I'll schedule appointments with people on a weekly, and I'll say, do you want to talk to me weekly? Do you want to do every other day? How do you want to work this? They'll say weekly, but every 3 days I'm calling them, hey, how you doing? I just have a question. You got to reach out to people. You got to talk to people,
Yeah.
It's how you build the rapport, and if I have any paperwork in front of me that I need to do, I make it a conversation because, here in Rhode
Mm.
Island, we have paperwork, and it's good and it's needed, but, people are like,
Well,
oh, this again,
yeah.
no
Well,
paperwork. But if you
so
make it a conversation and you do it over a period at a time,
yeah.
like I do wellness plans with people, but I prolong it and I make it, let's do this
Mhm.
part of it this week and this part next week. And if you need to take a break the week after,
So, Kim, that's a really great segue to something that I wanted to ask you about kind of agencies and professionals, right, that are here to help when people reach out. So, and you have this really unique role of wearing two hats, right? So you're a peer recovery specialist, and you work at a formal agency that is set up to help. So you just talked about paperwork, right? We all hate that, but what advice would you give, or what do you think agencies or professionals out there, like therapists, doctors, case managers, whatever they may be, who are set up to help people, what could they do to make services more accessible? How could they reduce the stigma? How could they just make it easier for people who do take that step to reach out for professional help?
So my biggest thing is I would love to see every agency that, see FSRI is great. We have teams. But
Hmm.
what I would like to see is, of course, it's a big, long story, but the medical records be all in one spot. You know what I mean? So
Hmm.
that they don't have a person that comes in for, you know, lots of help and lots of trauma and alcoholism and substance use. They don't have to keep repeating that. It's in a system that we can access, so we can't keep putting them through that. But another way is to have a one-stop shop, I call it. You know what I
Mm.
mean? Primary care and all other services, kind of like a big recovery center with primary care and therapy and all in
Mm.
one.
Yeah.
This, let's send them there and let's send them over there, and well, you can get help down here, and this organization does this and this one does that. I mean, it's all
Hmm.
great. We have a lot of help, and Rhode Island's great for recovery. Like, we have so much stuff.
Hmm.
But if I
Yeah.
go back to the beginning of my recovery, the last thing I wanted to do was keep telling that story. I didn't have that substance inside me, and those feelings were raw.
Yeah.
And when
Yeah.
you have to keep telling that story with no substance inside you in early recovery, it's
Hmm.
very trying and very hard.
Hmm.
So I would love to see one-stop shops. You just tell it, here it is, here's the
And
paperwork.
then,
Let's reassess in 3 months.
Yeah, and I
yeah.
do think that's where nationally, and I know in Rhode Island,
Hmm.
where things are moving, right? That there was this
Right.
divide or these silos between substance use work, between kind of therapeutic or mental health work.
Yep.
We had to get our basic needs over here. We had to do our therapy over here. We had to do our recovery work over here. And I do, I think it's slow moving, as many things are, but I do think there is beginning to be an integration. And I do think that that's a really important message, Kim, at the
Hmm.
beginning of people's recovery, or when they are reaching out for help, when they are motivated for help. That's also when they're having the most symptoms related to talking about their experience, right? Because
Yep.
the more that we're able to talk about it in a therapeutic space, the less distressing it becomes. But if you haven't had that experience yet,
Hmm.
it might be the most distressing experience to share that. And yet we do have systems where people are sharing it or required to share it a lot. And to really experience that distress a lot before maybe getting to the right person or the right people for help.
Hmm.
Another barrier I see why we're on the topic is, and I still have the barrier myself, is technology. I work with some clients that still have flip phones. They don't know how to access Google. They don't know how to access Zoom meetings.
Hmm.
Me, I still struggle on a daily basis. Like, I want to learn now, so it's not like a struggle, but technology, there's people like myself that didn't turn a computer on until 3 years ago,
Mm-hmm.
that have to catch up with everybody else. And,
Hmm.
I have clients that can't do a Zoom meeting. They don't know how. So if they're you know, in a 12-step meeting, they're missing all of that on top of already being isolated.
Yeah.
So it's, you know, making all kinds of, you know, doctor's office and providers aware of, you know, the big things. And that's because we're going towards telehealth too.
Mm-hmm.
Yep.
You know,
That's a really good point.
People need to know how to access this.
Yeah.
Yes.
I mean, that's been a huge thing that I think people are really struggling with during COVID. Like organizations are trying to adapt to, or challenge that we're facing is that kind of the divide, right? Of, you know, we might have to use these platforms, and yet how do we serve everyone, right? And I think it's finding these solutions. But I've had people ask me, okay, I don't know how to get intranet, or I don't know where the document is that Cox needs to get, you know, to make sure that my price is reduced so I can afford it. And so I do think we need, in the midst of all of this, what's becoming clear is that there needs to be, you know, help with navigating those if we are going to move to, you know, to more kind of virtual or technological kind of platforms. So I'm thankful that you said that,
Free
Kim.
trainings.
And free trainings.
Yeah. Well, Kim, look at you now. You're on Facebook Live.
I know.
Yeah.
Who would have thought?
Yeah. 3 years ago, I didn't know what a link was. 4 years ago, I didn't know what a link was. My friend sent me a link to get into a class so I could be a peer recovery specialist. And I said, what's the link? What is a link?
Good for you. That's
I know.
awesome.
And the message is, if I can do it, anybody can do it. And when you're involved in recovery and you find that community and you find your tribe, you get the exact same that I have gotten. You know, they filled me with hope and they held my hand the whole way. So
That's awesome.
don't be afraid to reach out. We're in this together.
Well, that actually might be your answer to my last question, which is, if there are people listening who are struggling or may feel alone or isolated and are not sure where to turn for help, what advice might you give them on taking that next step?
Just do it. Just reach out. You know, it's the hardest thing in the world, but it's the most freeing thing you can ever do for yourself, is to reach out and call somebody, anybody, as long as it's going to lead you to, you know, a better path, not the old path.
Thank you. Thank you so much, Kim.
Thank you.
We are so appreciative of you taking the time this morning, but of the work that you do every day. You've impacted so many, and you know, I know I speak for both Kayla and I that it really is an honor and a pleasure to work with you. So we really appreciate you.
Thank you. You guys are my faves.
Well, thank you all out there who have joined us live. We are going to share additional resources related to our discussion today. So please visit us at www.familyserviceri.org for more information. We look forward to seeing you all next week. And we're going to have another important discussion about the impact of COVID-19 on domestic violence in our communities. And our special guest is going to be Tanya Harris, who is the Executive Director of the Rhode Island Coalition Against Domestic Violence. If you have other topics you would like us to cover, please feel free by letting us know in the comments. We thank you for joining us.
Yes, and be well and be safe. Thank you.
Thanks, Kim. Bye.
All right, thank you.